All right, let's dive into a choice that healthcare pros make literally thousands of times a day. Which IV fluid to hang? Now, it might seem super simple, right? But the answer, well, it can have some pretty serious life or death consequences. So let's get right into it.
So, picture this. You're in a critical situation in the ER. Do you reach for a bag of lactated ringers or do you grab the normal saline? I mean, this is a huge decision that every doctor, nurse, and paramedic has to make, and you've got to get it right.
Yeah, and this isn't just about getting some fluids into someone. Picking the wrong one can actually cause harm. You could turn a helpful IV into something that makes a patient's condition way, way worse. So understanding the difference, it's totally non-negotiable. Okay, so before we get into what makes them different, we've got to talk about the one big thing they have in common. This is kind of the foundation for everything else we're going to cover. And that key term is isotonic. Now, what does that even mean? All it means is that both of these fluids have a particle concentration that's really, really similar to our own blood. So what? Well, this lets them boost the volume in our circulatory system without causing water to rush into or out of our cells, which would be, bad. Okay, first up to the plate, lactated ringers. You'll often hear this one called the balanced solution, so let's break down what makes it so special. So this is way more than just salt water. Lactated ringers is like a carefully mixed cocktail. Of course, it's got the sodium and chloride you'd expect, but it also has other key players like potassium and calcium, plus this special ingredient, lactate. The whole thing is designed to be a dead ringer for our own blood plasma. And that lactate, oh man, that's its superstar feature. It's not just hanging out in there. Our body actually metabolizes it and turns it into bicarbonate. Now, why should you care? Because bicarbonate is a buffer. It fights against acidosis. That's when your blood gets too acidic. So LR can actually help fix a really dangerous pH problem. But, every hero has its kryptonite, right? For all the good things LR does, there is one specific situation where it can be downright dangerous. And that kryptonite is its potassium. See, in patients with really bad crush injuries, their damaged cells leak a ton of potassium into the bloodstream. That condition is called hyperkalemia, and it's super dangerous. If you give them LR, you're just adding more potassium to the fire, which can push those levels into a deadly range. So the takeaway here is simple and absolute. If you even think it's a crush injury, you do not use LR, period. All right, now let's talk about the other guy, Normal Saline. I mean, the name sounds totally safe, right? Normal. And the formula is super simple. But, as we're about to see, that simplicity has a hidden catch. And wow, the difference is pretty stark. Normal saline is literally just two things, sodium and chloride, in water. That's it. And because it's so simple, it was the go-to choice for decades. But now we know that simpler definitely isn't always better. Okay, so where's the problem? It's all about the chloride. That word normal in normal saline, it's a little misleading. It actually has a much higher concentration of chloride than your own blood does. And when you pump that much extra chloride into a person, you can throw their whole system out of whack. So what's the big deal? A little extra chloride? Who cares, right? Well, what kind of trouble can that actually cause? It can cause the exact problem that lactated ringers helps fix. All that extra chloride can lead to something called hyperchloremic metabolic acidosis. So think about it. You're trying to help a patient who might already be acidotic, and by giving them normal saline, you could be making things even worse. All right, so we've met our two contenders. We know their strengths, we know their weaknesses. Now it's time for the main event, putting them head-to-head in some real-life clinical showdowns. So let's really walk through this decision tree. If you've got massive fluid loss from, say, severe burns or trauma, you want the fluid that acts most like plasma and can fight acidosis. That's a clear win for lactated ringers. What about a patient in DKA who's already super acidotic? Again, LR is the obvious choice. But, and this is the big one, in that one key exception, a crush injury, you have to use normal saline to avoid that dangerous potassium in LR. And if you look at the world of burn and trauma care, where patients can need just massive amounts of fluid, the protocols are absolutely crystal clear. Lactated ringers is the standard of care. It's the right tool for that job. Okay, I know that was a lot of biochemistry to throw at you, so let's boil it all down into a few simple takeaways. Some memory hooks that'll really stick with you. Okay, memory hook number 1. Think of LR as the complex, balanced one. It's got potassium and lactate. that potassium means you avoid it in crush injuries, and that lactate makes it awesome for burns and acidosis. Got it? Memory hook number 2. For normal saline, think simple, but with that big chloride problem. That super high chloride means you really want to avoid it in patients who are already fighting acidosis, like someone in DKA. And finally, memory hook number 3. Look, if you only remember one single thing from all of this, please make it this. Burns equals LR. It is the undisputed champion in that fight. Always LR. So there you have it. The seemingly simple choice of grabbing an IV bag is just packed with all this complex biochemistry. It really makes you wonder, doesn't it? What other straightforward decisions in medicine are hiding a totally fascinating and critical story just below the surface?